New Zealand has shocked the world by lifting its smoking ban, a policy led by Prime Minister Jacinda Ardern, which prohibited the sale of cigarettes to individuals born after 2008. The surprising move is driven by the new government's desire to generate revenue for tax breaks. The initial smoking prohibition aimed to reduce smoking-related deaths, the primary avoidable cause of mortality in New Zealand, especially among the younger generation. The abrupt reversal of the smoking ban has triggered strong criticism from medical professionals. Professor Richard Edwards, a tobacco control researcher and public health expert at the University of Otago, expressed dismay, calling it a retrograde step on world-leading health measures. Health groups in New Zealand are urging the government to reconsider this decision. Last year, significant changes to the law were implemented, including reducing nicotine levels in cigarettes and limiting the number of tobacco shops, with global acclaim for their potential to save up to 5,000 lives annually. The UK government had even followed suit with a similar restriction on youth smoking in September, allegedly influenced by New Zealand's regulations. Despite being hailed as a public health initiative, some business organizations opposed the smoke-free laws in New Zealand, citing revenue loss for corner stores and newsagents. Newly appointed Prime Minister Chris Luxon argued that banning tobacco could lead to a black market, a stance not reflected in his party's pre-election campaign. The surprising repeal came to light during the recent election campaign when Finance Minister Nicola Willis revealed the government's intention to abolish the legislation. Willis attributed the change to pressure from the Libertarian Act and the populist New Zealand First Nationals coalition allies. The National Party, which won 38% of the vote, engaged in policy talks for weeks to form a government. The compromise reached allows the new administration to take office, with the removal of the smoking ban being a key element. The decision to overturn the legislation has raised concerns about the government's priorities, especially as it was initially designed to benefit public health. Critics argue that the move disproportionately affects Indigenous Maori people, who have the highest rates of smoking and related health issues, highlighting the potential negative impact on the health and well-being of all New Zealanders.